My name is Brittany Summerfield. I'm from Clearwater Valley Health in northern Idaho. I'm the radiology manager. I oversee all modalities at Clearwater.
I am Becky Wolf. I am the radiology operations manager for Diagnostic Radiology at Nebraska Medicine here in Omaha, Nebraska.
My name is Tammy Elliott. I am the MR Safety Officer for Children's Health in Plano, Texas. We were nominated for Cassling's Imaging for Impact Award, which brought me here today.
We started a mobile mammography program recently, and we brought that to a rural community of about 3,000 people. So just because we're a small hospital in rural Idaho doesn't mean that we can't bring big services like other larger facilities offer.
We have definitely felt the crunch of that labor shortage. We're not unique. One of the biggest outcomes, I would say, that it's come from the staffing shortage is building our relationships with our educational partners, both UNMC and Clarkson College.
What people don't realize when you work with pediatrics is that not only are you treating the patient, you're treating the family too. For MRI, you have to coach patients through exams. So if you take somebody's ability to hear you, you can't coach them, you can't tell them this is all normal. You've got 5 minutes in this exam, 5 minutes in this sequence, whatever that case may be. So you kind of take the coaching aspect out, which is why I wanted to have the visual way to tell them, okay, you've got 5 minutes left.
So we did have a mobile service from a neighboring community about an hour away, but they had to decommission their equipment. We didn't want our community to be unserved. So we went forward with fundraising and secured a grant, got leadership support, and started our own mobile mammo.
I myself started my career as a student tech trainee. This is not a new program. It is a hands-on program where students who are in their second year of education can come work in our department as a temporary limited technologist. This allows them to develop that confidence, that workflow, just all those skills that you look for in technologists when you're going to hire them after they graduate.
People want to be heard and don't want to be isolated. Well, people who have hearing impairments tend to be isolated because they can't hear. So it's kind of helped take that barrier away. The families have been super excited about it also.
Rad Academy is an immersive program. It is geared towards high school students. The goal is to spark that excitement about a career in medical imaging. We have had the opportunity to receive feedback in which several students that have attended Rad Academy have actually decided to pursue a career in medical imaging afterwards.
In our first 2 months, we were able to screen over 200 patients. We've had a few stories of patients that have just come to us and they wouldn't have got that service otherwise, but because it was in their community, they were able to get their screening done, which actually led to an early diagnosis. So just the positive feedback from the community providers has been huge.
That's why we get into healthcare, so that we can make people better, not only on the physical level, but on the emotional level too.
So in my 3 years as the radiology operations manager for Diagnostic Radiology, I am so proud to say that our turnover rate has reduced by over 20%. I'm also incredibly proud to say that in fiscal year 2025, we retained 80% of our technologist trainees from the program that we talked about previously. So I think that the combined efforts of recruitment along with the support definitely leads to increased retention.
I would like to thank Cassling again for the recognition of our hard work and dedication.